helping us in building this session that we believe that can be important and useful for all of us, and the different aspects we have in the ERN CRANIO. The topic of the educational session is radiology in craniofacial malformation. We know we have a few radiologists, so we are trying to involve them in our network in order to provide a better knowledge of these kind of pathologies. And the proposal came 2 years ago within the ENT network, in which we proposed to involve radiologists, to Bas Pulnes, the leader of our group, and then to Irene, and they welcomed this very useful, I think, proposal. And that's why we are proposing and try to build from now on, so nothing is settled yet, you can be involved in this network, and to be involved in this cross-sectional work stream in which we think we can involve radiologists to add their expertise in each of our specific fields. Why we need to involve radiologists? Because we are different animals, but same beast, as Kobe Bryant said in the past. And so we have different expertise. For example, we love light, and radiologists love darkness, while we love people and they love images. But going beyond these jokes, we face the patient with a clinical issue, and we ask them awkward requests that sometimes it is difficult to deal with and to interpret, and trying to get what we want from them. And also we sometimes ask them to give us images, but they can give more to us and to our field, giving an interpretation between the anatomical malformation they can see and the possible functional outcome that it may be related to. And also we always look to solve the specific clinical issue, but the radiology and the imaging they provide can look beyond the specific request we are making, both in terms of clinical issues and surgical issues. So this can add a lot to our networks, we believe. That's why we are starting this kickoff with these friends radiologists. So what we expect to do with this cross-work stream? Well, better characterize the rare diseases, because radiology can add a lot. Optimize the imaging, because in early childhood we ask to perform a CT maybe for hearing loss, and then we ask for another kind of surgery or another district, and maybe thinking that there is a whole plan for the whole life of the child, we can plan it better, maybe thinking with the radiologist what is the best for the urgency and then for the future. Consequently, a better preparation for surgery. Going beyond the specific clinical or surgical issue we are asking the images for, and then trying to connect the anatomical malformations to the functional anomalies we see in clinical practice that may be related to something we don't know yet. And in the end, to share a common classification of the anomalies, because sometimes we know that there are some controversies about the interpretation of some kind of anomalies, and share common guidelines about the treatable pathologies and the leave-alone lesions. So the plan for the educational session is to discuss a little bit about the ENT perspective and the role of radiology in it. Peter Tarnow will discuss about the surgical role of imaging. Then there will be Renzo Manara about the cerebral, vascular and neural anomalies in craniofacial malformations. Then Anna Tietze about CAT and MRI evaluation in craniosynostosis, and then there will be Silvia Valeggia about the black bone sequences in these patients. A quick presentation of each of us. I am Davide Brotto, and I'm from Italy, from the University of Padua, and my main expertise is otology and neurotology, audiological problems and phoniatics problems. And I'm here because I was the one that proposed this cross-work team, and this is why I'm organizing this educational session. Then we will have Peter Tarnot, that comes from the Gothenburg Craniofacial Center, and he is a plastic surgeon with an expertise about craniosynostosis, cleft lip and cleft palate disorders. And then we will have Professor Renzo Manara, that comes from my university, and he is the co-leader of this educational session with a specific experience in neuroradiology, pediatric neuroradiology, and temporal bone imaging. Then we will have Anna Titze from this center, from the Charité, from Berlin, and she is a neuroradiologist with a specific training in Denmark, and then she came here in Berlin since the 2016, and she deals with pediatric neuroradiology and radiology as a whole. And at last but least, not the less important person, is Silvia Vareggia, that is a resident from our center that participated to the European Joint Program on Rare Diseases, and she is developing a study with the Erasmus Medical Center about the use of specific MRI sequences for the study of craniosynostosis. So from her presentation, maybe we can get as a take-home message what we can get from the European Joint Program on Rare Diseases and the exchange clinical program, and also that we can build together in the radiology field. So thank you for this part.